Welcome to week 6. Interesting week 6 so far. Always an interesting time when we get to spend it with you here on the Audible. Sigmund Bloom, Cecil Lammey on assignment, Dr. Jene Bramel, Matt Waldman, and Matt, as I alluded to, maybe a Thursday night game going a little different than expected.
Yeah, it's been a good one so far. I mean, obviously the quarterback play has been up and down on both sides, and but you've seen some fun play out of Daniel Jones a little bit in terms of being able to hit some plays downfield. Both teams are being able to rush the passer reasonably well. You've got a little bit of a running game with the Giants, a whole lot of the running game with the Patriots, and some special teams play that resulted in a touchdown for the Patriots, as well as a sack fumble by Lorenzo Carter that was returned by Marcus Golden, who ended up getting stretching over a tackle that Josh Gordon made that looked like it hyperextended his knee. So I'm sure we're going to put Gene to work early on that one.
Yes.
But certainly, overall it looked like it was going to be a bit of a laugher by New England. And then the resiliency of the Giants kind of showed up there, and they're not playing too badly. I mean, I think that Daniel Jones has had some good plays. There's a nice big long play to Golden Tate for a touchdown on one of those, kind of fades from the slot that has worked so well now in the NFL. But he's also had some plays where there probably should have been about 3 or 4 interceptions in this game from him that he's kind of lucked out on not throwing, in addition to the one that he did toss.
All right, Gene. Well, have you been able to get some video from Twitter, or did you see it live, or anything you want to add right now? The latest I saw was someone said Andrew Sauer says, heard a report he's up on the bike jogging. What do we know right now about this developing situation, Gene?
The Patriots are calling it a knee injury, and this is one of those injuries that has high ankle sprain components and knee sprain MCL components to it. I probably would have leaned towards a high ankle sprain from the beginning on that. So, and those injuries tend to be, both these things are possible to come back from in the same game. Just based on stiffness, and then by the time they're in the locker room the following day, they struggle. But he was clearly trying to keep something warm on the exercise bike, as you guys noticed before. I like knee over ankle in terms of chances of coming back this week, and then in 10 days the following week. Hopefully that's the way things trend, and it's going to be tough, I think, to keep him loose and limber through halftime. If he comes back and he's on the field in the second half, I think that's great.
Okay, that was just a warm up. Now we're going to do our rounds. We'll pepper you, Doc, with throw it up, see what you can do with this, like batting practice.
It'll be a busy week.
It is going to be a busy week, and there's some important and/ors. We have 4 teams on bye too, so that complicates things, and it makes us have to go a little deeper on our benches sometimes, or onto the waiver wire. Start with Todd Gurley, because he played on Thursday night, and then he comes back with a quad bruise. And Sean McVay, I thought, took an interesting step of telling us we didn't know about it. He just showed up with it. Hasn't practiced yet. Playing San Francisco this weekend. What do you think?
Yeah, I'm not sure where Sean McVay, I mean, I'm with you. That sounded kind of interesting. The other thing I don't really like about this is Todd Gurley's comments over the last 24 hours haven't been positive at all. Talking about Malcolm Brown, talking about Darrell Henderson, talking about we'll sort of see how this progresses. He's got to keep himself right, all those sorts of things. And sometimes quad bruises, you don't think that much of them, but if there's a lot of bleeding in the muscle and it takes a little bit of time to heal, or it's in an unusual spot, maybe it's more than a bruise and there's a muscle strain involved too. It's just hard to know. But the tone of his comments on Thursday were not good. And right now I would lean towards him being inactive. And if he is active, I know we just finally got him kind of back into over the last couple of weeks. A couple of weeks he only had 5 carries, but I think he had like 13 or 14 passing targets. And then last week had such a big percentage of the snaps and carries as well. And just coming off of those 2 weeks of, kind of an upward trend, for him to be saying that he's not certain he's going to be able to play this week after a Thursday night game the week before isn't very positive at all.
Let's just get into the trenches here and talk about the 49ers, who certainly looked excellent on Monday night, but they lost Mike McGlinchey, and that's their second tackle that's out. And you said it's going to be multiple weeks with the arthroscopic knee surgery with the meniscus tear. As a bigger guy, are there any more concerns about him returning later, or is it more because he's one of those big guys in the middle who seem to play with, injuries that would wreck skill players pretty much for a season or a half a season? Is he going to suit up and be able to play earlier?
I think that's going to depend on where the area of meniscus injury is and what they find during the surgery itself. The fact that they gave 4 to 6 weeks, whereas sometimes we hear these skill position guys in that 2 to 4 week range with this, makes you wonder whether or not they're a little bit more concerned about him or whether or not they're planning to rehab him slowly. With the 49ers schedule being what it is, they've already had their bye week. So, they're probably not going to give them a lot of extra time to recover if they can. But that's in San Francisco, Dallas, Cincinnati. There's lots of teams this week that are probably going to be without both their projected starting tackles. Dallas is going to be an issue. San Francisco's guys are both for sure out. Staley's not coming back for a couple of weeks, and as you said, McGlinchey's out for a month. So you're going to see how this progresses. But time frame wise, 4 weeks is probably the over under. Hopefully, it's closer to that than it is the 6.
Well, Gene, let's stay in the trenches because there's some potentially pivotal situations like Mike Pouncey in the pivot, a big shakeup there on the Chargers line, and the Bucks right side of their line. You can fill in the blanks here. There's not so much a question about their availability this week in either case, but I feel like this is something people need to factor into their Chargers and Buccaneers outlooks for this week and maybe longer.
Yeah, at Kansas City too. I mean,
Yep, Andrew Wiley.
With Eric Fisher on that on the line being out for over a month as well. There's some offensive lines that are struggling. I think probably being a little bit underrated there. So the Dallas issue, I think, is the most compelling to me this week. I think for the most part, we know that most of those other players are not going to play. They've already been ruled out. And in Pouncey's case, he's already on injured reserve. So those guys aren't going. But based on the trends, no matter how optimistic Jerry Jones wants to be in the aftermath of these injuries, saying that Tyron Smith, we got the best possible news. Well, that doesn't mean that high ankle sprain isn't going to be a multiple week injury, even though these offensive linemen and Tyron Smith and Lyle Collins and Zach Martin, they're all involved in that. They've been playing through a mess of back injuries for years now in Smith's case. After the game, on Monday, we're hearing that Collins' injury was, not structural and reassuring, but he's not practicing. And, there was apparently some physical exam indications that was an MCL injury, even if the Cowboys don't really want to admit to that. He's not practicing either. And unlike last week where he wasn't practicing Wednesday and Thursday with his own back condition, and that was likely a situation where the Cowboys didn't want to put him at risk of missing a game at all, knowing that they were hoping that his back spasms would settle down and he'd be able to go on Sunday. This is a totally different deal with the knee. This is a very much minute-to-minute situation, and with him not practicing at all, I think there's a chance we see some limited practice on Friday in anticipation of seeing how his knee responds to a little bit extra work. But I think both of these guys are trending towards not playing, and Zach Martin continues to battle through his back issues of his own. The Cowboys line is just in danger of missing multiple guys as anybody else this week.
So, Gene, any concern from Christian McCaffrey and the fact that he did that little flip over the Jaguars defender and landed on his back and in the end zone, and you could tell he was kind of wincing from that, but he played the rest of the game.
Right, and I think that's the key, right? Is if he hadn't come back to the rest of the game, and they were so far ahead at that point that the fact that he wasn't rumbling for those extra 80 yards that their backup running back got in the fourth quarter, I don't think concerns me that much. Ron Rivera is relatively straightforward about injuries, and he said this is probably going to be the new normal with McCaffrey. His workload is so high, and he's so critical to the offense that giving him Wednesdays off is, it's not a big deal. We're not talking about 3 very important practices. They know how they're going to use him in the game plan. There's really no sense in putting him in harm's way at all. He winced a little bit. That was, you're flipping over in the air, 6 foot up in the air and landed on your back somewhat unexpectedly. But full practice on Thursday, you'd expect him to do something on Friday, whether it's full or not. And unless we hear something completely uninspiring tomorrow, I expect him to play this weekend.
Well, Gene, Steely Scent, always a favorite in the chat room. Talk about David Johnson yet. Snagged Edmonds after the preview show. Any clarity? And Gene, I just want to add to this one that his back locked up. And that sounds like something I have to look forward to. My back locking up. He's 27. So
hopefully you're not being smashed by 350 pounders on a minute-to-minute basis. So you probably have a couple of extra years before your back starts locking up on you. I'll just sit up straight in this chair so it doesn't happen to me over the course of the show.
Yeah.
He's another one where I just don't like the tone of how things are going. It's day to day. We'll see how things go. A lot of these back injuries, again, they're, back spasms are kind of temperamental situations, and just giving some guys some extra time to recover. But I didn't really like what Cliff Kingsbury said. David Johnson hasn't been positive. It's another situation where it certainly seems like we're trending towards these guys being inactive. With some of the other ones we talked about. And I imagine there's going to be one or two of these guys that end up being a little bit closer to probable than we expected by the end of the weekend. But the trend on David Johnson doesn't sound good either.
I'm just sitting here watching the Progressive Insurance and wondering why they're actually wearing like, kitchenware as in terms of, in terms of what they're doing. I don't get it. So anyway, how about Julio Jones and the hip injury? Anything to add or shed light about?
The folks that watched practice today suggested that he was moving pretty well, and I think this is going to be another situation where we've seen this over the last 2 or 3 years with Julio, whether it's one injury designation or another, where he's limited earlier in the week, and instead of putting him on the injury report as a not injury designation or veteran rest, or there's lots of different ways that gets described, that he then increases his practice participation and is fine, relatively speaking, by the end of the week. So the biggest key with Jones is always, if you see him fully practice on Friday and he's taken off the game status report, then there's no concern at all. If he's listed as limited and questionable, then we're going to have to look into things a little bit more. But the tone of the reports on Thursday suggests that the Friday practice report is not going to be a concern.
Gene, I'm sometimes guilty of not paying enough mind to injuries because they aren't necessarily going to affect a player's availability. But of course, doing weekly projections, I should be thinking about how it's going to affect their play. And then also, we sometimes find these things, we come back a few weeks down the line and we remember, oh, well, Alvin Kamara showed up on the injury report limited with an ankle, or Chris Carson showed up limited with a shoulder, and they play and they're reasonably productive and so on. But then 2 or 3 weeks down the line, they're on it again. And it can be a situation that can come back to haunt us as trying to count on these players and these players' availability. So anything setting off any alarms about either of these midweek limited from the lead running backs?
I don't think so. I mean, again, these guys don't really get much contact in practice in the middle of the week. And for both of them to not be listed on the practice participation report on Wednesday as getting any treatment at all, if it was a knee, if it was a hamstring, calf, quad, what have you, where, maybe something did happen in practice and we have to be worried that it's a new injury that's a concern. These seem like they're more likely to be nagging issues than anything else. There's not a lot about Kamara out there, but I think there would be if this was a concerning ankle situation at all. Chris Carson and the shoulder, the Seahawks let him talk to the media today, which they would not do. It would just be Pete Carroll talking about the situation if they were worried about him. I don't think that either Carson or Penny are going to be an issue. Penny was a full participant, so there's probably no issue there at all. As always, we're watching the Friday report to make sure that there's not a downgrade in situation, but I expect both of them to be doing something on Friday, and I would doubt that either one of them is listed questionable. Maybe Carson, but I think both of them are going to be expected to get their full workload this week.
Let's look ahead to Monday night, and we have Matthew Stafford, who had a hip injury and has been playing with one for a little bit. And you kind of wondered with the nature of that, whether it could be something even like, say, some sciatica from a ruptured disc or something like that. And could he be playing with a ruptured disc? But he practiced in full on Wednesday, which seems like it would be a good sign. So I'd like to have you kind of just talk a little bit about the injury that he might have there. And then TJ Hawkinson also had a limited practice after the concussion that he suffered from trying to jump over people. So let us know what do you think of that pair of the pitch and catch duo in Detroit?
I think Stafford is going to play through pretty much anything, right? I mean, he's kind of proven that to us over the years. I think your speculation about, we heard back, we heard hip, and the way to put those together can be sciatica, where you've got, the primary issue is the back, but the pain is in the hip or the buttocks or the leg or what have you. I would tend to doubt that that's going to be a limiting situation for him. I think we probably would have heard some other things. He looks a little bit limited on the field, but the full practice is pretty reassuring. The TJ Hawkinson situation is going to be interesting. We can throw Mason Rudolph into this as well, and have a larger discussion about concussions. And as scary as those things looked on the field, I don't, in general, you should not consider loss of consciousness to be the most scary of concussion symptoms in the moment. So a lot of times there are other symptoms that are more likely to last a little bit longer or portend a longer recovery from a concussion, things like, and things we won't know. So do they remember the injury? Do they remember the hit? Do they remember what happened in the plays before? Do they remember what happened in the time frame afterward? And how long did those levels of amnesia start? Do they have a history of migraines or motion sickness or some behavioral health disorder? We know that those symptoms tend to last a little bit longer. Not to be minimizing what we saw on the field and how scary that appeared, but I don't think we need to maybe jump to a conclusion that the medical staffs aren't acting in the best interest. In fact, over the last few years, even though as recently as the last couple of years, we still kind of hear people suggest that maybe it's best that people do nothing after a concussion. That actually prolongs recovery. So it's good for these guys, assuming they're not feeling so terrible that they're likely to feel worse after doing a little bit of light exercise, getting them out there and doing some things. And it's probably not yet rising to the level of a lot of position specific stuff. And they're definitely not being put in a contact situation yet. This is part of the early stages of the protocol where they get their heart rate up a little bit and do a little bit of exercise. That's good for their recovery. And it is good to see how they respond to those things. So I don't know that either one of these players are going to play this week. I think it's what we're hearing from the Steelers, even though Rudolph is in limited practice, is that he's running the scout team and they're not really preparing him to play. And they've already got a backup plan in place, such as it is with Paxton Lynch on the practice squad. So they may give Rudolph a chance to see how Thursday's practice goes into Friday. Hockenson may be a little bit closer to playing. We don't get a lot of information out of Detroit, but I don't get the sense from the beat writers that it's already clear around the team. And sometimes what happens is, we're not going to hear anything from the team, but the teammates know what's going on, and the beat writers can sense that in the locker room, and it bleeds into their coverage a little bit. And I'm not really getting that sense. There has actually been some good discussion about Darius Slay and some of the other players, as far as Quandre Diggs, as far as how close they are to returning. We're not really getting that from Hockenson. So the sense I'm getting with him is they're allowing him to progress through the protocol, and if they feel like he's close enough to take contact, that we may see him do a little bit more on Friday and be sent to the independent neurologist, where I think I would lean towards Rudolph probably not playing. We'll know about Hockenson tomorrow on Friday, though.
Gene, let's talk Chiefs. All right. Let's look at three things. One, is Sammy Watkins going to play? No. How long is it going to be out? I don't know. It's Sammy Watkins. Right.
Well, you led into this on Sunday morning saying, can we trust this guy? And I said, well, I was kind of moved by the same things that Matt was moved by in the preseason, where we're kind of remaking his body, and the Chiefs seem to have a little bit better handle on his overall conditioning. But, did he even play a play?
I don't know. I'm not
sure
know
whether there was something that happened.
Is it better or worse? Is it better if he played a play, or is it better if he didn't play a play?
Sunday night injury, not practicing Wednesday, Thursday. There's no word out of Kansas City at all. Yes, I agree with you. The question is, how long is he going to be out? Not will he play this week?
Right. Okay. And Tyreek Hill, well, soon, but maybe not yet.
So this is different than Sam Darnold. So when you're talking about, is there likely to be interval improvement in an enlarged spleen in 3 days to last week? So that probably wasn't likely. But when you're talking about the stability of a joint like this, when you've cleared him to do everything but contact, they probably, I don't know that they were actively trying to make that decision on Sunday or Monday. They were continuing to allow him to condition. And then once they clear him for contact, he's already in good cardiovascular condition. And so maybe they were waiting until the end of the week to make this decision. I don't think we know that for certain, but tomorrow's practice participation and comments from the coaching staff and Hill himself are going to be informative. We are right at that. Again, there's comps, but there's not many. So it's like 4 people that we can use over the past 6 or 7 years as comparison's sake. And I keep going back to Danny Amendola in his 5-week recovery, but that doesn't mean that this isn't going to stretch into 5 to 6 rather than 4 to 5 weeks. So we're right at the cusp. It's reasonable to expect Hill to be cleared to play this week, but there's no guarantee or foregone conclusion that that's going to happen. Okay. So the Chiefs are going to be diligent. I think we'll know tomorrow. I don't think this is, the Chiefs may call this a game time decision, but they're going to know where things are. So if we see them moving some players around or planning otherwise, or we hear anything other than Hill is good to go on Friday, then I think we need to be concerned.
Okay, and then the last, and thank you for your patience, Matt. The last and most important is Patrick Mahomes. And full practice, okay. But Gene, Patrick Mahomes performs death-defying feats And it would follow that maybe something that takes him a little bit out of his physical element could show up more in his game maybe than other players that aren't right at that edge of the impossible. And this is not his first ankle injury this year. They're going to keep listing him as full. How, from your estimation, is he playing with something in NFL terms that is not really extraordinary, or do you think now this is getting potentially into the worry zone no matter how they list him on the injury report?
I think you have to be worried about Mahomes because unlike when you've got Wiley and Fisher and the full complement of wide receivers to put him in a position to succeed, if the longer he's in the pocket, the shallower the pocket gets, the more likely he is for there to be trash around his ankles or for him to have to escape the pocket and put that ankle at risk of another tweak. And we saw the end of the first half, the beginning of the second half, that he really wasn't right moving around the pocket, and it hampered and limited him. And as the rest of the game went on, closer to the second half, whether it was the adrenaline of the 2-minute drill or just him getting further away from the most recent tweak of this injury, he seemed to move a little bit better. But, if these guys aren't there on the offensive line and Tyreek Hill doesn't play and Sammy Watkins isn't there, and he's relying on Demarcus Robinson and Byron Pringle and everybody other than Travis Kelce to open up that offense a little bit, at some point you have to have Andy Reid's scheme is amazing, but you've got to have the players to execute it. And they've had elite players to execute it. So to answer your question, I don't think he's playing with anything unusual. There wasn't any particular violent mechanism of tweak to say that what was a low-grade high ankle sprain is now something more and he's really going to be limited. It was great to see him back to a full practice. That means that when he showed up in the locker room on Monday that it wasn't a whole lot worse than it was on Sunday night. But it's going to depend on, if he's leaving the pocket and people are falling all over his legs during the game, he's going to be at risk of another tweak and see what we saw for most of the second half last week.
So any word on Christian Kirk? What, in terms of his ankle?
His ankle mechanism looked pretty significant when it happened, but he's been able to get back to limited practice this week. I think they're planning on taking him all the way up to game time. These high ankle sprains, we've talked about this over the years. It's not something you can brace. It's really difficult. I mean, there's certain types of bracing and tape jobs, but you really can't stabilize that type of ankle sprain in the same way you could a sprain on the outside of the ankle. So it's really going to depend on when we get to as close to game speed as possible, does he feel comfortable moving and cutting? And he's probably not a player where the Cardinals are going to say, if you're 80%, we're going to let you ride. So I think he's kind of questionable at best, but I'm willing and open to more practice participation than we expect on Friday and a closer to a questionable listing. I think that's the way it's going to go. I think we're probably going to see a questionable listing, and then we'll be waiting to hear on Saturday night and Sunday morning whether he's going to play.
Last round here, and Gene, you kind of already answered it, but I just want to hear you go back over or distill it, because the two situations are a little bit different too. TJ Hawkinson and Mason Rudolph. And you said that I would never expect you to, or anybody in your position to say that these medical staffs don't have the players' best interest at heart. But, were you alarmed at all to see that Mason Rudolph was back at practice based on what we could observe? I'm a Steelers fan, so I'm going to throw out things like it'd be irresponsible if he played or something like that. I mean, I just want to get your general take on this situation.
I think the point of my comments before and kind of what I want to stress now is I don't want anybody to look at any player that's diagnosed with a concussion and have any sense that one player is closer to recovering than another. Every single one of these injuries are different. We really don't have much idea. I mean, we do in some sense because there's a practice participation report, but we really don't have any sense of what their symptoms were immediately, other than what we can see, what they were in the hours afterward, what they were 24 hours later, and how they've responded in any way to the exercise protocol. So the moment that there are minimal symptoms or no symptoms, they can start to progress through the protocol a little bit. And we don't want these players doing nothing. I mean, this would be the same way we'd manage, the younger players. And we're probably a little bit less likely to progress the younger players through the protocol as quickly as what the NFL does, simply because these guys are in the NFL. They're in the facility many, many hours a day. So they can be observed and they can be progressed a little bit more quickly because there can be multiple exams done and what have you. So I would certainly not use the word irresponsible for a player that looked like there was a more severe injury. Again, we've kind of already
Well,
talked
that's a fair
about.
question. Like, how much can we really deduce based on things that we can perceive from the outside about the severity? I mean, would you say to characterize Mason Rudolph's concussion as severe? And we've had to talk about this.
No. Again,
Yeah.
I don't forget about grading concussions. There are no mild, moderate, severe. In the end, what matters is how soon did your symptoms resolve? How significant was the progression of symptoms, and how long did you take to get better? And then maybe in hindsight, you can say, well, this was a concussion that took 4 weeks for the symptoms to resolve, and somebody else had a concussion that only had a week to resolve. And even then, I don't want to say one was mild and the other one was severe.
Mm-hmm.
So I don't think we fully understand the cumulative effects of concussions yet, and we don't have a lot of diet. I mean, we do the best we can. Some of it is based on self-reported symptoms. Some of it's based on balance testing and cognitive testing and what we can see with our eyes on neurologic exam. But ultimately, there's not something that we can do where we can say, okay, you've got this level of brain injury or you've got this. That's not there. And when we first started doing this show 10 to 15 years ago, was still within the Academy of Neurology's protocol where we would grade them, grade 1, grade 2, mild, moderate, severe. At that point, if people didn't have symptoms 15 minutes later, you were considering sending them back into the game.
Right.
And that's not the case anymore. So, I mean, I know that I'm not coming down on you about this, but
No.
I think the stress about this discussion tonight is, yes, it's scary to watch that, and we saw Juju Smith's response and Marquise Pouncey's response, and all that's important, and we need to be concerned about the appearance of the player on the field in the moment. But I don't want to overreact to one particular symptom. Not to say, again, I'm not saying that these are not important symptoms to track, but it's okay for a player to start getting a little bit of exercise. It is okay for a team to put them through the protocol. Those steps are there. They're the best we have for a reason. Some teams are probably going to be a little bit more cautious. I think over the last couple of years, we've seen many more teams choose to put players through the protocol a little bit more slowly. And many more players are taking 2 weeks to go through the protocol and be recovered and cleared than they were in the past, even when we started doing a little bit better. We talk about irresponsible. What always would bother me was the Michael Vick dirt in the eye or the Colt McCoy going back out on the field after clearly being concussed. And that still happens from time to time, but it doesn't happen as often. Those are the areas that I think probably still require a little bit of education. And otherwise, just the diagnosis and the self-reporting and the otherwise. I'm not. I will be surprised if Mason Rudolph plays this week, but it's not necessarily because of the appearance on the field as much as it is what we're hearing about his progression, and the medical staff just generally being more cautious. I don't know if that answers your question, but
No, it does.
Really, you guys have probably seen over the years. This is one of the things that I don't want to say I enjoy, but I think this is an important part of the education of the sports medicine side of things. And this is part of the reason that I still enjoy doing this with you guys, is because I think there's an education component to it, and it mirrors what I talk about on Friday nights on the sideline and what we discuss. I had this discussion twice in clinic today, and I think it's important. The more we talk about this and the more we have an understanding of what's going on, it helps young players, parents, whoever. And I'm not saying I'm anything special about what we're talking about listening, but I think that's a big part of what we try to do here is to help folks. We're talking about the minutia of high ankle sprains versus low ankle sprains and what this back injury may mean or not. But I think this is a pretty important topic for everybody that's listening to have a pretty good understanding. And again, I can't stress this enough. I'm not minimizing how worrisome and scary this looks on the field. I just want to stress the importance of not reading into one symptom too much, or otherwise you just have to be careful about trusting, as you said, that everybody has best interest in heart, and that players are self-reporting symptoms in the best way possible, and so on and so forth. So
look,
I don't know if you want to clarify a little bit more of that, or if you want to go back and forth. But
I just wanted to give you a chance to talk about this. So you're you're always extremely responsible when you speak and staying in terms of your knowledge and what you know to be accurate, but also with a sense of what the larger conversation is. You hear what all of us that aren't informed say and opine and pontificate, but at the same time, the future of the sport hinges on the education and research in this area, basically, when we get down to it. So I know that what you're going to report is really the best knowledge at the time, because as you said, over the last 10 or 15 years, it has evolved, or at least the situation has progressed in terms of the discussion and the knowledge. So no, man, it's great, because I think you're right that it's also an outreach education issue. And my wife, Kate, my love, she wants to talk about speech therapists and getting more on the staff to help rehab these players from these injuries the same way we would a physical injury. So there's a lot of room to go, and as long as people have your take on it, then we'll go ahead.
And that's another comment I make pretty frequently, is you don't really think of it. It was really not discussed in that way. And I don't mean to imply that you can rehab a concussion in the same way that you can rehab an ankle injury, because they're totally different. It's a physical versus cognitive rehab. But these players are being rehabbed because of the different types of symptoms, not different types of concussions. I don't know if I want to go quite that far, but you can classify a concussion in a number of different ways based on the type of symptoms that that players and folks present with, and they can be rehabbed in different ways, from sensory to visual symptoms to balance symptoms and otherwise. And yeah, I think it makes a lot of sense. We talked about having mental health professionals on staff.
Oh yeah.
And I think there's lots of different, this isn't, we've got a team orthopedist and we've got a team internist. There's a lot there, and all of the very important support staff, from the trainers and the physical therapists and all of that. There's a role for all of those folks. And as we learn more and more about these injuries, I think the medical staff is not going to do anything other than expand, from medical providers themselves to analytics folks and otherwise. So there's going to be a lot of change in coming years. As you mentioned, it's critical to the long-term health, no pun intended, of the sport.
Yeah, I mean, I think this is, just to kind of cap it off, I'll put it simply and just say, if any of you are still here who were kind of thinking to yourself that you were bored by this conversation and you're a parent, please do not enroll your children in football, because you have no understanding of and no desire to actually learn about what needs to happen. And you would not be responsible. And that's not the opinion of football guys or Jene Bramel or Sigmund Bloom, just my dumb opinion. But
and I think there's less and less and less of that. I used to feel like I had to do a lot of education about concussions and help folks to understand how important and significant this injury could be, kind of fighting against the tough guy culture. And there is still some of that all the way through the youngest levels of sports. But I feel like anymore, the tone of the conversations, at least in my experience, has been help me to understand this. Let's make sure that my son and daughter are ready to go back when possible. So I think we're seeing less and less of that. Hopefully, all of the discussions that we've had, NFL, NHL, professional sports or otherwise, over the years have been a part of that. So again, thanks for letting me kind of ramble and rant on about that. I know that kind of got a little bit longer than probably what we'll usually talk about, but I think it's a good thing to discuss, and I've seen it being discussed on Twitter. How is it right? Why does it feel so icky? Why does it feel icky that we saw Mason Rudolph staring off to the sky and his teammates really nervous about him, and then on Wednesday he's out there in a helmet throwing a ball around? Is that okay? I think that's a good question to have, but make sure that we have it with the right frame of mind, and that we continue to expect and hope the NFL medical staffs are making the best decisions possible. And in the last couple of years, I think there's been a lot of improvements in player safety. There's still some bobbles and some hiccups along the way, but I think, like we said, I think this is too important to expect otherwise.
And it's actually quite natural, especially in today's social media and hyper media environment, that people will overreact and underreact to things. First, they tend to underreact. Then when they are basically informed, or in some cases shamed into feeling a certain way, then they end up overreacting to every possible thing as a result of that. So it's nice to kind of have a balanced discussion and nuanced discussion about this. So moving.
Well, one last thing I'll say.
All right.
I am glad that we're overreacting in this way.
Yes.
5 years ago, we were overreacting. Get back on the field.
That's right.
So I'm much happier to see people. Let's hold these guys out an extra week. Let's make sure this is okay. And whether it's the CTE discussion or behavioral health discussion or whatever it is, the tone of this conversation has clearly changed, and I think it's changed for the better.
But I would disagree with you about the terminology you used. I would call it nuanced, not overreacting, which is actually a more nuanced, balanced way and cautious way of looking at it. But moving from the nuanced of the head let's go to where a lot of times people would think about or would think with when it comes to like just football and life and all sorts of other things. How about the groin injuries of CJ Mosley? And I think we have, and Chris Jones, one of my favorite players who was like dominant before this happened. What's going on with that area of the body?
So let's figure out the right way to put this. You would think of the groin area of the body as a relatively narrow area, but there's a number of muscles in that area. We'll often hear groin injuries called groin injuries when they're actually more abdominal muscle and in the sports hernia side of things. From Deshaun Jackson to Chris Jones to CJ Mosley to so many other players, it's hard to know what's groin, what's hip, what's abdomen, and otherwise. The tone of the conversation from Kansas City is that of all the injuries that they suffered last week, that Jones's may be the most significant, which suggests that the groin injury he has is of a relatively high grade. And not to go into the minutiae of that, but sometimes the higher grade injuries, depending on which groin muscle is involved, are a little bit easier to recover from. But they're still going to be 3 to 4 week injuries. CJ Mosley, it sounded like that the Jets were hopeful that coming out of the bye week he'd be able to do a little bit more, but just didn't progress as quickly as possible. It can be a little bit difficult injury to rehab depending on how much bleeding there is in the area and how long it takes to get those muscles reactivated, or if there's a higher grade injury, quicker rehab. So with a little bit of luck, I think maybe we hear that CJ Mosley comes back next week. But when you hear very doubtful to play, you almost like these guys, whether it's no matter what type of soft tissue injury it is, you want to get them back where they've got a limited practice or so, a week of limited practice and recondition so that they're not within that window of aggravation. So I would be probably targeting, you hope you get Mosley back by week 8. Next week is in question, and the same thing is going to go with Chris Jones. I think this is going to end up being a multiple week injury too.
Dr. Gene, thank you so much always. And it's your compass. I mean, your knowledge and your experience and the just, integrity you bring to your subject.
Speaking of which,
it's fun, man. Yeah.
I have a question for Gene. I just saw Rodney Anderson get hugged by Robert Kraft. Would you like to be hugged by Robert Kraft?
I got to take myself off mute for this. That's an on the couch discussion.
Yeah.
And I think I've talked way too much already tonight. No. So I'm going to bow out on that one.
Thank you, Gene. And I get the feeling that anytime Gene would apologize for something and he call it a rant, it's probably something that really needs to be said. And we all need more Jene Bramel people like Gene.
Well, I appreciate your indulgence anyway.
Yeah.
I don't know. It's one of the things I like to talk about. So hopefully y'all don't get a bunch of fussy folks responding about.
We'll have Robert Kraft. We'll let Robert Kraft hug him.
Exactly. Then we'll send them a certificate.
We'll see you Sunday morning, boys.
See you.
Thank you. And here we go. The Packers. Right. Someone mentioned the Packers. You have a Packers sweatshirt on?
Yeah, I went to Milwaukee for an event, for a speaking event, and I got this when I was at Lambeau Field. So why not? So
Yeah, and I'm trying to find it, but I can't. Jared said that you have a Browns hat in a box buried in there. It is in a shoe box in the backyard. So,
oh no, I have it. I actually still have it on my shelf every time. But though it's funny because every time I take it out off the shelf, my Steelers hat falls off of it. Or every time I grab the Steelers hat to dust something with it, the Browns hat falls off the shelf.
Sure. So we're watching tonight, and the Giants still hanging around. I guess some of the comments in the chat room to lead me to just a couple of the general questions coming out of watching this game. Sure. Matt, one is Tom Brady getting older? Is Tom Brady eroding? Is this just more, give the Patriots some time and they'll be the Patriots that we have come to know on the offensive side of the ball?
I think it's give some Patriots some time because I've seen some, and I hate to say it this way, but I feel like the more I watch the game, the less I can bear to watch the commentary that just like generalists have on TV about players and, and sometimes I even like what these people have to say about the tangential stuff about the sport, commentary, social issues, whatever, but when they start talking about evaluating players, it's just like, please. And the whole idea that Tom Brady's getting worse is when you have a guy on here that I've never even heard of at wide receiver playing outside number 80. I can't even pronounce his name because I've never heard him before.
Gunnar Olszewski.
Yeah.
Yeah.
Yeah. I mean, seriously, there's so much timing involved in the passing game and understanding of different concepts. And I understand that maybe he missed some plays to more familiar guys early, but he was 17 for 24 at the half. Okay, that's not bad. That's not bad at all. So maybe we're used to the unconscious numbers that are great when you have a fully stocked team of supporting cast around you. But he doesn't look bad to me. I think that he made some bad plays, but nothing that I'm looking at where, he missed some throws, but some of the throws were either you could tell that they were either a miscommunication about the bend or break of the route, or it was just an off throw here and there. So I'm not, I think his decline will be swift. It will not be slow. Adam Harstad did a really great job of talking about the decline of players in this week's roundtable, and something that he's talked about along with Chase Stewart, using a lot of Chase Stewart's fine work as well to show that it's not that guys usually have a slow decline. It's usually an all of a sudden, oh my God, they're horrible now. And I think that the only thing that's horrible is the commentary about, oh my God, Tom Brady, he kind of looks horrible. Is he done? You'll know when he's done. He's not done yet.
Not done yet. Are the Browns done yet? I mean, not done, but is this fixable? Are we seeing all that stuff that floated around? Kitchens was smaller than Dorsey, somebody that he knew he could control, and he now the talk of he's in over his head and things like that. And for fantasy, because it's Odell Beckham, seeing Eric Stoner's texting me like, "Hey, the Giants won the trade."
Yeah, I did that with me too today.
Yeah. So
Hey,
Eric Stoner's always, I know he's practically on the show, but it's great because I feel like he's thinking about a lot of the same things that I'm thinking about, that we're all thinking about. Yeah. What about the Browns?
Well, I'll say this so that Eric can't just smile in private about this. He disagreed. He disagreed with you to me about James Conner. He thought James Conner looked all right, and good. So did I.
I'd be happy with that. Yeah.
And I said, well, I said Bloom's a Steelers fan, so right. I mean, how's he reliable on being able to comment on that? So you asking me about the Browns is probably the same way, which is why I mentioned that. But I'll say this: my thoughts on Cleveland is, I don't understand that. I don't understand how on earth they think. Well, I do. They spent a lot of money and a first overall pick on Baker Mayfield. So they feel forced, and by their ego, by the pressure, by the position, to make this offense about him. This offense should be about Nick Chubb. And I know that, yes, it's because I like Nick Chubb, and maybe it's because I'm invested in him as much as I am emotionally and in terms of what I've analyzed and put out there. But it's more because when you look at Baker Mayfield and how he's played, it's pretty much what I thought pre-draft. He doesn't read through progressions great. He doesn't show anticipation in compressed areas. He doesn't own the pocket when the pressure is off the edges and forces him to stay in the pocket. He doesn't want to step up, climb, and throw because, if it's taller defenders, he probably doesn't see over them well, or really the real answer is that he doesn't see between the lanes well and hasn't done that enough. So there's an issue there. And so for them to go from the Ravens game where they just spanked the Baltimore Ravens with the run game, and they put Baker Mayfield under center, and they use the run game in a really positive way to set up Mayfield to do what he does best. And then last week they lined up in shotgun and were running from shotgun. And when they did run from under center, they didn't throw from under center. It was like they just abandoned what they did against Baltimore and just said, well, the chrysalis of the caterpillar is now about to become a butterfly. And I kind of showed that jokingly on Twitter, and of a woman who was letting go of a butterfly to her kids, and the dog jumped up and ate the butterfly. And it was like, you watch this, and I'm thinking, Baltimore, you had this all set up. Keep doing what you did. Stay patient. But they got so impatient so early. I just think that the Browns are done this year. I don't think that they're coming back from this. I don't think that I don't think the offensive line is good enough to sustain what they want to do. And I think there's a lot of pressure for them to make Baker Mayfield be what he's not, which is a franchise caliber quarterback. He might become a good starting quarterback in the league. But I think there's way too much, put on that. And we saw with Seattle, we've seen with the Falcons at one point. We've even seen with the 49ers themselves. I mean, Jimmy Garoppolo, we have no idea. Jimmy Garoppolo at this point might as well be in the same class as Baker Mayfield and Daniel Jones. And Daniel Jones is playing better right now in terms of what's going on. But, as untested guys, and, they run the ball plenty and they do fine. And I think that Cleveland is just wasting away a good player in terms of that. I mean, Lamar Jackson is a very good young quarterback, but he still has things to learn, but they're using him to his advantages, to his strengths. Because if you put Lamar Jackson in this offense, we'd have a lot more rushing yards. He'd be hit. He'd be sacked a lot more, but we'd also probably have, we'd probably be talking about him in the way that everyone was who were downers on him at the end of last year. So yeah, I think this is done, and it's testing my patience with this team.
Well, Matt, we get into like psychoanalysis, right? We're psychoanalyzing these teams as if they're a person and saying, where's the gap? Like first commandment, like know thyself, right? As long as a team knows itself, then even if you don't have a lot of raw firepower, if you execute a way to bring to bear what you do have, that can be much more effective than these teams that don't know what they have, or otherwise create some tension between what the team themselves. And this is where we would talk about player empowerment, right? Because sometimes you can say, well, you can't let the players run the team. There has to be some sense of like a hierarchy and almost military style, like falling in line, chain of command. But on the other hand, the players can know the game and know better than the coaches. And that's when the tension's created. Go ahead.
I was listening to Ed Reed on Rich Eisen today, and it was like a clip that I saw on YouTube. And I don't really listen to Rich Eisen very often. Nothing against him. It just happened to be on there. But Ed Reed has had a chance to coach, and he talked about how he hasn't really gotten much more of a chance since. And a lot of it he put on some of the coaches in the NFL and how they're kind of recycled guys who get threatened by stuff and he was treated with disrespect, like he was just a player, not a coach. And, and he's like, listen, not only did I know the scheme and not only know how to teach scheme, but I also know how to teach technique. And a lot of you guys only know how to teach by the book. And trust me, I've heard player after player after player talk about how a lot of these coaches are that way. And it takes them 90 hours to do what should take 60 or 70. And if I were, if I had the chance to do my experiment franchise, as I've written about in Cleveland before, I'd make an addendum to it. I'd hire Ed Reed as my coach. He should have been a Cleveland Brown anyway. Know, right? I mean, right. I'm at this point, I'm starting to think, should I have just been a Baltimore Raven fan and just moved with them? I even bought a Ravens hat, I have to say, this week. So,
I understand. I understand.
It's tough, man. It's tough. It's tough to watch those two teams and you see them and Browns fans. I mean, you understand, even if you hate that, it's how it is. So
even with the turmoil and the crossroads the Steelers were at, I want to root for Lamar Jackson. I want to see a Lamar Jackson team.
John Harbaugh, like he's like the better. He's the better of the two brothers. I mean, he's like the reasonable,
like the same one. Yeah, exactly.
Yeah.
He's the one you can communicate with. Yeah, I want to see a Teddy Bridgewater team succeed. I like seeing Gardner Minshew succeed. I like what it means that he's succeeding, and also John DeFilippo. And again, talk about knowing thyself. Like Minnesota, John DeFilippo was not the problem in Minnesota. Obviously, now we can see by what's happening in Jacksonville. And it's interesting how the personality of that franchise changed so completely when the quarterback changed. I think it was already underway with Nick Foles.
Yes.
And Gardner Minshew was just this serendipitous turn. But Gardner Minshew, Matt, makes me think of Mike Leach. And that's really the one prayer candle I want to light. Because Trevor Sikkema did at Draft Network. The Draft Network stuff is great. Everybody there is great. It's a piece on college coaches you might be thinking about next year. If you're already thinking about next year. And Mike Leach just said something to the effect of, he'll listen, if the NFL comes calling. I'm lighting a prayer candle for Mike Leach, NFL head coach.
I mean, I think that would be fun, and I think that it would be worthwhile to again create more diversity to what goes on in the NFL. But I think all this is great, except that we still have slappies for owners in terms of how they are, and the same with the GMs that they hire and what they demand and what they expect, and they don't just get the F out of the way in terms of letting people do things.
So it's funny that you say this, because I did my rant at the end of the couch, like 10 or 15 minutes, talked about the NBA and China and things like that. And on a similar related note, I don't know if we've had this conversation, Matt. I can't remember who I've said what to. I have this vision, I have this dream of a player-owned league, of the NFL owned by the players, where the teams are owned by the players. And, you know, it has obviously has a parallel of like what we might want to reproduce in our society, right? And basically what's happening, the conversation too, and it's funny because it started in the NBA, or people think of it that way, like player autonomy, right? Like some players, at least above a certain threshold, having the power to determine their destiny. The Le'Veon Bell whole saga was about that to an extent. But I think, you know, the Jalen Ramsey situation, even the Stephon Diggs situation, Antonio Brown, which turns it into more like an Aesop's fable with how that one goes. But the idea of player autonomy, and I wonder with the NCAA, you saw Todd Gurley's shirt, by the way, it said like not caring about athletes.
Yeah.
So good for him. It's an interesting trend. It's an interesting trend. Anyway, I guess I'll just leave that hanging out there.
I agree. And I think that's, you know, I'll take it a different way and say this. If the NFL owners were different in the way that if they tried a little bit harder to actually make this about the players, and to make this about, you know, really doing their best to manage an organization, but they've been brought up in a management style and raised in a certain way that, I mean, if you're super liberal, you're going to say they're like robber barons, you know, and if you're super conservative, then you're just going to say this is about them following the capitalist culture and doing what they were supposed to do. And I think if you're sensible, I'm going to say that it's about that they have the right to run their businesses the way they do, but to a certain extent, but they've had government basically allow them to have certain advantages and certain bully pulpits in ways that stifle the best of what they could be. And they don't really have competition. And if they did, you know, there might be things done differently that would push these guys out of business, because to be honest with you, here's the thing. Jacksonville does look a lot better. That's where we got back to. They look a lot better. So why in the hell is Jalen Ramsey wanting a trade? Well, we know why that is, because of Doug Marrone. Well, why is it about
Tom
Doug
Coughlin?
Marrone?
I think it's Tom Coughlin, actually.
So it might, so Tom Coughlin heading on down, because maybe it's too militaristic. Maybe it's some sort of miscommunication. Maybe it's that, shut up, we don't want to hear you because you're just a farmhand on our, on our great piece of land here. Yeah. So maybe there's a little bit of that going on here. I just think that if you actually hired evolved coaches who weren't in some sort of buddy network, who actually knew how to manage people, knew how to teach technique, and we actually had some developmental going on and some other things, maybe the owners wouldn't need free agency. Because one of the things that I loved about old football was no free agency. I understand for the players' needs, but for free agent, I didn't like free agency from the standpoint as a selfish fan who wanted to see my players grow with the same team, and watch them develop and have them be there for 8, 10, 12, 15 years, not have to keep buying freaking jerseys every 5 years, for the new player that came in or the old one, wherever he moved to. I want to grow up I want to see my kids grow up and watch a player throughout their career, or a team that had the same players. And now we can play even more complex versions of football that show how good a team can actually play together, as opposed to what we have now, which is just a bunch of, rent a player kind of situations. By the time they finally get comfortable, well, it's time to get some money. So let's go somewhere else, where now I'm going to be in a dumbed down offense and a dumbed down defense. That to me, I don't particularly like.
It's hard because, well, look, one thing I want to emphasize is we're winding up here in the last couple of minutes. And sorry, folks, I shouldn't apologize because
It's Rant Thursday, I guess.
It's Rant Thursday. It is. And there was just a turnover, by the way, another defensive touchdown by the Patriots. The Giants really, I think, should be very proud of and also the Patriots are beatable. The Patriots aren't scary this year. The AFC's wide open right now. Wide freaking open. Sorry, Joe. First of all, Matt, to your comments, it's not a meritocracy. If we could boil everything down that we kind of want to hopefully have the pendulum swing back on many levels in our society and culture right now, it's not a meritocracy, and we want to make it a little more of a meritocracy. In fact, not only is it not a meritocracy, sometimes the qualities that are selected for are the worst qualities. The filters to make it through the filters to get to some of these places where this kind of power is wielded, this kind of influence, this kind of wealth. It's again like almost like a mythological or Aesop's fable, where the qualities it thwarts the flourishing of people, basically. I mean, it's kind of nature by design. But what you're and the thing with the free agency, and you're right, it disrupts continuity and the identity of a player. Now it's a big thing for player plays the whole career with one franchise, right? But it also stands for player empowerment, because it's this idea of, is the player employed by the league, and the league basically can do whatever they want with them, tell them whatever laundry they want them to wear, whatever, for whatever price, or are they kind of like an independent contractor who can be in charge of selling their services? And we want something where we want more player empowerment. But all of these things are building more tension now. I mean, it's monumental, Matt. I don't think we've really grasped like the California bill and now all the bills that are going to follow, where we really pierced something that has been part of our lives.
But I think it's going to force teams to actually, I'm hoping someday, and I know it's not going to happen as if I even say it, but I'm hoping that it'll force teams that, because players have more empowerment, that they start to cater more towards players to find a way to retain them.
Well, yeah.
Retain them. And I think that, because to me, that's the goal. I would want, if I were an owner, I'd be thinking, I know that there are certain players we're going to have to let go because they command the top of the market. But I want to be able to get good players who can play great in my system, who are like, yeah, I could make an extra $200,000, an extra $500,000. I might be able to make an extra $1 million in the scheme of the millions that I'm making, but I'd rather stay here and win a championship. I'd rather stay here and contend. I'd rather
just like my work, like the people that I'm sitting with in the locker room every day, like the way we go about our business.
Yeah,
feel good about it.
And
like
I think
reflects my values.
In order to do that, that means that you feel like that you fit within the team, and that you're going to be used best within your team, and that you have a shot of winning it all. Because you always have to, as a competitor, as an athlete, you're always going to want to win it all if you're a good player, in terms of like good player up here. I know we have some players who are like, it's just about the money for them, but I think that's best
fair, but
that's fair, but it's like, but I think the best players have that competitive streak inside of them. They want to win. But they want to win on every level, just like owners want to win on every level. That's kind of the part of the problem, is that we think of ambition as winning everything. We've got the fastest car, some of these guys I watch, I like look at Rupert Murdoch and his trophy wife and he thinks he won because he got a woman 30 years younger than him. Whatever, whatever it is, I won this negotiation. I won this deal. I won this thing. I live with a professional negotiator. And what makes her a good negotiator is that she thinks about how everyone wins.
Exactly.
And that's
alignment.
I think you have to have a higher ambition other than just winning every single small thing in your day, and understanding how to win on a broader level. And I think that some people have too much ego to understand that or comprehend that. And that's why we end up where we are.
Yeah. Instead of making the universe, turning it into like musical instruments that just sing your name back to you, actually being part of a symphony, actually being part of something that creates harmony, that brings something together to create something greater than what one individual can, just simply by having dominion over things. But that's for another talk.
They're never going to want us to do this show again. You know,
I know. Well, wait until we do the couch. We're doing the couch. We're doing the couch next week,
and we will talk about football.
Yeah, we will. We will. Thank you, everybody. Always. No,
Yes.
It's wonderful to get to spend time with you, to be with this community, and love seeing everyone in the chat room. It's an exciting week 6. We'll be back Sunday morning. And I might have a surprise, maybe not this week, but I'm going to be working on something fun for Sunday morning, by the way, Matt. Just a fun little addition in the spirit of Anchorman. So there's that to forward to. By the way, if we get to 10,000 subscribers on the, we're like 9,710, 9.71, something like that. If we get to 10,000, there's going to be something special that happens. So subscribe to the YouTube channel, folks. And we'll be back Sunday morning, and we've got some great games: New Orleans and Jacksonville, Minnesota and Philadelphia, Green Bay and Detroit Monday night. A lot of good games.
Atlanta's defense for fantasy owners.
Right. An arena football game in Arizona. So thank you, everybody, always for joining us. We love spending this time with you because you're so very classy.